everyone for coming. My name is Lucy Earle. I'm a Social Development Advisor in Humanitarian Response Group in DFID. I'm going to talk really briefly about where this has come from and what we're up to in DFID at the moment before handing over to Victoria to give a little bit more detail on that. But I think quite a few of you were either came along or were invited to a series of consultation workshops we had earlier in the year. The idea behind these was to bring together people working on or with an interest in doing more work on urban humanitarian crises and to slightly push them beyond their comfort zones and think outside their sector and consider city systems and how those are impacted by humanitarian crises, whether natural disasters or conflict-related emergencies. So we had 4 of those workshops on 4 sort of different types of systems that we thought were perhaps the most important systems happening that sort of make up a city, looking at governance systems, markets, the built environment, and then sort of diverse, complex community and social systems. And we wanted to make sure that we were up to date within DFID on what our partners and academics were up to. We wanted to stimulate discussion and start to signal that DFID was interested in improving our own practice in terms of humanitarian response and our support to partners and others. And we also wanted to inform our plans from these discussions about where future DFID support should go and what we should do differently in urban emergencies in future. So Victoria's going to talk after me and give a little bit of a synthesis of the 4 consultation workshops and what they came up with. And then moving on from that, this report that we're going to hear about today, the literature review, this was us sort of wanting to marry more of the operational side of urban humanitarian response with what the academic literature is saying about what's happening. And we're very pleased that after some arm twisting that Kirsty and some colleagues agreed to take this on. We asked again TPU to look at sort of city systems, and they actually come up with a slightly different set of systems, a different way of cutting the cake, and I think there probably might be a bit of discussion about that because it's quite hard to divide up the city in this way, and I imagine we'll see that quite a lot of the literature is quite sector focused, so again it's quite hard to push different ways of understanding the city. The ways that sort of perhaps urbanists are used to understanding cities perhaps doesn't fit so closely the way that humanitarians are used to dividing up their work. So we wanted Kirsty and Don and others to look at the availability and the quality of evidence, both on the impact that disasters have on city systems, but also what the impact of the humanitarian response then is, both positive and negative, taking into account that sometimes humanitarian action in cities can actually prolong the transition period or can skew local markets, etc., etc. So we wanted to look at whether the literature was available and the quality of that literature on those issues. And the aim today is to discuss the emerging findings. It's an ongoing piece of work, and Kirsty will be able to tell you about when it's going to be ready to circulate and for you all to have a look at and comment on. But we really wanted to sort of whet your appetite to read the report and be ready to sort of input with comments, and at this point as well to sort of test some emerging findings. So I would like now to hand over to Victoria, who's going to talk a little bit about the consultation process. But Victoria is secondee into DFID at the moment and is a doctoral candidate at UCL. And she's been helping with the rapporteuring and writing up of the consultations. And just before I forget, the synthesis report has been very kindly put on the ALNAP community practice for us. And once the literature review is finalised, it will also be hopefully be made available there. So I'll hand over to Victoria.
Yeah, so as Lisa said, I was responsible for reporting on the 4 workshops that we had earlier this year. As Lisa mentioned, we covered 4 topics: governments, the built environment, complex communities and markets. There were 65 participants from about 40 different organisations. So as Lisa mentioned, we tried to get as wide a variety of opinions as possible. And several people gave presentations also at the beginning of each day. So we had presentations from a wide range of countries and sectors. So I will just remind us of the key topics that we discussed and some of the key recommendations. So to start with, we talked about working with governments. We talked about different types of government and different types of cities. So we talked about the difference of working with national, subnational and local governments and in different types of cities. The way a disaster affecting a secondary city would not have the same impact and then would not have the same type of response if you were working on a disaster that directly affected a capital city such as Port-au-Prince. We talked about that national government is typically responsible for strategy, whereas you would be working more with the local government with regard to implementation. We talked about different types of city governments having different levels of decentralisation. So depending on the context in which you're working, you can't necessarily assume that the mayor or whatever is responsible for water and sanitation infrastructure, or this kind of thing will vary in different settings, and they may or may not have the power or authority to influence the system that you're trying to work in. We talked about the importance of understanding these different power relations between different types of government at different levels, and that those are not typically skills that are within humanitarian organisations at the moment. We talked always, of course, because we talked about humanitarian response, so we talked about the relationship between disasters and development. We talked about how it was important that urban humanitarian response took a developmental perspective, a developmental approach to response and early recovery, and we talked about the importance of preparedness in urban response. I think that's similar in anytime you talk to humanitarians about disaster response. What was interesting, I think, was the discussion we had around how humanitarians need to better understand cities and the informal growth of cities in general, and then how humanitarian interventions are operating within that context. So there was a great case study, obviously Port-au-Prince is a great case study of the informal growth of Port-au-Prince and how humanitarian interventions have altered that now in the longer term. They're part of this ongoing story of that city. We talked about the great pressure that governments are under in humanitarian response, and that they're dealing with a situation which has overwhelmed their capacity. It wouldn't be a disaster unless it had pushed them beyond what they can normally respond to. But the challenges are not just technical, they're also administrative. There's a need for technical specialisms that they may not have already, and there's also just a need for administrative resources to respond to the disaster on this scale. So one of the key recommendations was around establishing a urban technical surge capacity roster to enable national or international staff to be seconded into government from a range of other actors, from development organisations, from government elsewhere in government, or from the private sector or from academia. We talked about the importance of coordination, that relief is better coordinated than it was in the past because of the cluster system and things like this, but in recovery and reconstruction there are still significant challenges because of the organisations moving into relief and reconstruction may lack the mandate to coordinate and to work in those areas. They may lack the technical capacity to do that, or they may lack there is a lack of funding for coordination of recovery and reconstruction. And many participants emphasise the importance of government leading coordination as soon as possible after the disaster. So some of the key recommendations from that workshop were working with government, firstly to understand their power structures, their needs and their capacity, and then support them throughout relief, recovery and reconstruction. Rather than going to governments and saying, we have this project, do you want to work with us on this? Saying, we're here to support you, what are your projects, how are we going to work in partnership with you over the longer term of this recovery process? I mentioned already the recommendation to establish a system to provide urban technical surge capacity, and also about the importance of government-led recovery and reconstruction, and establishing a platform for that as soon as possible after a disaster. In the built environment workshop, we talked a lot about the complex needs of urban communities, requiring multi-sectoral programs to respond to those needs effectively, and that urban humanitarian response also pushes us to implement programs at a larger scale than usual, rather than moving from an individual or household level approach, adopting neighbourhood level approaches or larger systems-based approaches. Also that recovery may happen very rapidly in urban areas or happens very, very differently for different sections of the population, so programmes need to be flexible to adapt to those changing needs over time. If we want to run these multi-sectoral, multi-level programmes, then multi-sector assessment becomes very important. So there was quite a big discussion on how that can be done and the challenges of trying to do multi-sector assessment in the relief phase, or how assessment could be lightweight, rapid in the beginning, and then multi-sector assessments could then inform recovery and reconstruction programmes, how these different things can be brought together. In the built environment session, we talked about market-based approaches, both to the delivery of humanitarian assistance and also of how humanitarian assistance can support the recovery of markets. I'll discuss this more in the market session, but we also raise the importance of the scope of markets needs to expand beyond the way we're considering it at the moment. A lot of discussion about cash-based or market-based approaches at the moment. A lot of our case studies are around provision of food, water, or construction materials, but when we're working in urban environments, we need to consider housing, health, education. There are markets for all of these things, which humanitarian interventions are part of. We talked about infrastructure networks, such as transport, water, etc. And then we had an interesting discussion about whether or not whether humanitarian organisations should or could reconstruct infrastructure networks, and then whether if they do that, those are the formal systems in the city, and are those really supporting recovery of the vulnerable groups who are probably not connected to formal systems already. And the need, if we're going to do any of those things, often the need comes up to work with the private sector, and the expertise for working with infrastructure, large-scale infrastructure systems, is not currently within humanitarian organisations. I would summarise the recommendations from the built environment session under these two things: the great urban humanitarian response pushing us towards multi-sectoral, multi-level and flexible programming, and enabling rather than providing approaches. So, and I would argue that market-based approaches and intervening in infrastructure systems are both examples of enabling approaches, which is not something we do so much at the moment. In complex communities, we discussed the different types of identity that people have within the city, and that they may belong to, rather than being a community of place, like we're used to dealing with a village or something, they will be part of various different communities of religion, of ethnicity, where they work, and that this makes it much more difficult than usual to identify who to assist and how to intervene. Then with regard to targeting, there was a lot of discussion around blanket targeting. So in the built environment session, we're saying, well, we want to take more neighbourhood-based approaches. But then in the complex community session, we're saying, well, if we take a neighbourhood-based approach, then we have inclusion or exclusion error, because some of the people you're assisting are not the most vulnerable. So how to deal with that? So there was discussion of how blanket approaches could be appropriate in the relief phase, and then more nuanced, more detailed assessments could inform more detailed support and interventions later in recovery and reconstruction. We talked about how to work with communities and the importance of understanding social and political contexts, and again we discussed power analysis and the need to look towards development actors for expertise in this area. We talked about the advantages, the opportunities posed by urban humanitarian response with regard to technology, and that there might be a greater number of people with access to mobile phones and TV and this kind of thing, but also that there's a greater variety of audiences, and that there will be a greater number of messages already out there that we're competing with. So it's a much more analysis is required of the context and of the messages that we want to put across into that already messy and complicated context, if we want to communicate efficiently with communities. The private sector were mentioned again, both as sources of data, because service providers, communications companies may already have significant amounts of data on the communities that we would like to work with, but they can also be partners in communicating the messages that we want to put across. We talked a bit about protection, and that access to information is a critical protection issue and should be part of vulnerability assessment. That people have rights, people may have rights to services that they're not aware of, and the complexities around people may not want to register for assistance because of protection issues. Also that language itself can exacerbate conflict. So key recommendations from that workshop were that there are existing tools, but that they need adaptation and development for urban contexts. So particularly tools for context, vulnerability, capacity and needs assessment, around community engagement, around power analysis and around communications. In the final session on working with markets, we talked about existing experiences in market assessment for humanitarian response, of which there isn't very much. But what there is often a market assessment to inform a programme, so a market assessment of the market for CGI materials or water supply or something like this, and also that there are a variety of different ways of doing these assessments. So there was a call for standardisation of the assessments and also of more multi-sectoral assessments, and then leading on from the discussions in the other workshops, assessment of markets that we're not currently considering to such an extent: housing, health, education, transport, etc. The challenge again with calling for multi-sectoral approaches is twofold in markets, because firstly, where does market sit within the current humanitarian coordination system, and then where would a multi-sectoral approach to market sit within the current humanitarian system, which is highly sectoral. So the coordination of market-based assessment is challenging. We talked about working with governments and working with the private sector in advance of disasters to understand existing markets and identify how they could either be strengthened or contingency planning with regard to markets. We talked again about power analysis, about how markets are controlled by elites who may be formal, non-formal, in power, not in government, not in government, and that intervening in these systems, I think this is a key message that came from all the workshops, intervening in these systems is complicated, and we need to better understand the context of that system before we make our intervention. Again, we talked about learning from the private sector. To summarise recommendations from markets, participants recommended a better understanding of market networks and stakeholders as part of preparedness. I mentioned this already. The second point I think was very interesting, that market-based assessments, and I think it links back to the assessments discussion in the built environment workshop, and I think assessment came up on every day, that relief is acceptable, that relief is maybe a single sector, but during the relief phase, it was mentioned several times the importance of doing integrated assessments to inform recovery programming. And particularly in the markets day, it was quite a clear recommendation that donors should be funding integrated market assessment during the relief phase, so that assessment becomes an open source product for the humanitarian community, for everyone to design their recovery programming. I think that was an interesting and quite clear recommendation from the markets workshop, but I think it's interesting to think about how that could work for other sectors or in general. I mentioned already the expansion of our current view of markets and market-based approaches to include all these different types of markets that exist in urban areas. And again, greater collaboration with the private sector, from the tiny and informal through to global international companies. There was a comment that if Coca-Cola can re-establish their supply chain to get a small by-the-roadside stall recovered and with a, buy your Coca-Cola here sign, how can we learn from that, and how can we support markets to recover as quickly as that? I think that is my brief, hopefully, summary of the workshops. That can't really do it justice. For those who've read the report, I think it was probably boring, but hopefully it just jogs our memory and that we can try to start to see the connections with what Cassidy and Don are going to present.
So picking up from there, I think that just as an overall reaction to your presentation, I think that what is in the literature is a lot more general and probably less operationally specific than what came out of the workshops, because I think in the workshops, and certainly from your report, there's really a lot of interesting detail in there that's often not in the literature. So this literature review has been done by a team of us at DPU and also a colleague from International Alert, Janani Vivekanata. Today there's myself, Cassidy, Donald Brown, who's going to present, and we also have Julian Walker, who will lead the discussion later. So not all of us are present today. We're going to present some of the findings from the literature review and how we're approaching it, but I think that it's really a work in progress. There are sections that we haven't finished. We've sort of amassed a lot of the literature. We haven't looked through everything yet. We committed to having a workshop today, so we're presenting sort of a work in progress at this point because we have the date already set and it's very difficult to get everyone together. I think what we're planning to do is that in the next 2 to 3 weeks, I think we'll have a full draft and we'll have DFID will review it first and then we'll send it out to everyone. So if you're interested in reviewing it to provide comments, please let me know. I'd be happy to provide it to you at that time. The aims of the workshop, as Lucy already mentioned, were to share the interim findings on the literature review and to gain insights into the relationship between practical experience and the evidence in the literature, because many of you here today are working in practice, so the idea is to have a discussion between what's in the literature and what's in practice. And also to inform recommendation on areas for investment in research and innovation. So I'd like to do that in the breakout groups later, is to discuss some of those things. The context, I won't go into too much detail on this because I think we're all very clear, but essentially that humanitarian response has been in rural settings and the border of urban areas. There's certainly a concentration of crises and disasters happening in urban areas. Yet governments, UN NGOs are struggling to become operationally effective, as we saw from the workshops. There's a lot of issues that they're trying to cover. And policymakers need better evidence on how emergencies affect urban systems, markets, governance, and infrastructure, and how the responses impact on these. And I can say the impact of the responses on these systems is not well documented in the literature at this point, and work that needs to be done. So what we aim to do in the literature review is to assess the available evidence about the challenges of humanitarian response to conflict and disasters in urban areas, to improve understanding of how humanitarian response can impact both positively and negatively on city systems. That one I'm saying, we're struggling with that particular element at this point in time from the literature. Identify gaps in the evidence and provide recommendations for the development of future research innovation programs. And all of this is to inform DFID's current work on urban humanitarian response, how they work with partner institutions to adapt to the urbanization of emergencies. So these were the research questions that we were given in the terms of reference. What are the main challenges in developing a humanitarian response approach to urban settings? How do these challenges differ when the crisis is caused by conflict and when it is caused by natural disaster? So we've tried to look at both of those elements. How are market systems affected by urban crises? What types of impact do humanitarian response in urban areas have on the functioning of market systems? And what evidence exists on good practice to support and restore these markets? And then a similar question on how crises affect the organization and governance of urban areas. So we've tried to look at the governance, of which I think there's more literature on that than on the markets, certainly. The third question is, how do different types of hazard effect and the hazard and crises affect urban infrastructure systems? And I'll go into a little bit this about how we're trying to tackle that or how we're thinking of it. And as Lucy mentioned, there's sort of how to connect between cluster system and humanitarian response and urban, the way that cities and urban systems are organized. And then we've done some work on the diversity of urban communities. So we've renamed this from complex communities to diversity, and we'll address why we've done that in the presentation. And also what we're going to do in the review is to look at mainstreaming the protection of vulnerable groups. So we'll try to look at this across all of them, although that's sort of dealt with in a quite minor way today. So what I'll present is our analytical framework, a couple of notes about the quality of the evidence that we found so far, and I'll discuss the impacts of crises on urban areas and the challenges of urban response in relation to the 4 questions that were in the terms of reference on governance, infrastructure, markets, and diverse communities, and then some general ideas on evidence and knowledge gaps. Just a word on how we're doing this. What we've tried to do is look at evidence produced by humanitarian grey literature and scholarly literature with an emphasis on the scholarly literature because we want to see what is sort of being done in kind of peer-reviewed things, but we've also drawn on quite a large amount of humanitarian grey literature because the scholarly literature is not that large. There's a real focus on the emergency phase. Of course, we're interested in overall recovery and how emergency supports early recovery and longer term recovery. But what we're trying to focus in is really on those initial response phases. We've taken an urban development focus, so being the DPU, the majority of our work is on urban issues. So we're trying to look at it from that lens, which is probably slightly different than the way that humanitarian response organizations and people look at things. So hopefully that will contribute something to the debate and the conversation and the way you look at things. So we've looked at literature from humanitarian studies, disaster, conflict studies that are focused or relate to urban context, or from case studies that are urban. So when you search urban, you may not necessarily get that much, but you have to look through and see, the place upon which the case study is based, and is that an urban area? So there's a fair amount of sort of picking through things to try to see what is really urban experience and what isn't. We've also looked at the public health field, so we've done quite a bit of work on the health side of things, which is actually quite interesting, and there's more literature there. We've tried to broaden the focus to address the underlying vulnerabilities that perpetuate risk and insecurity in urban crises, in addition to the more immediate needs among crisis-affected populations. So we're talking about chronic crises versus acute crises in cities, and sort of the vulnerability of people across all of those situations. The way we've been working is that Donald has been the research assistant on it, and so the senior researchers have identified the sort of themes and trends in the literature, and John has been going through it and trying to draft the section. So that's the way that we've been doing the review. We want to look at urban crises. So in that way, what kind of situations are we looking at? And so what we tried to do is sort of conceptualize how we would see the different aspects that impact on urban crises. So we're interested in urban areas that are affected by disasters and climate change. And often these kind of areas of risk for disaster and climate change are underpinned by endemic poverty, low coverage of basic infrastructure and services, and quite weak governance. So cities that have this kind of high risk. And often will be affected by high human losses, and households that are very vulnerable to these losses. So you may not have massive economic losses, but at the household level you have major impacts on people's health, on their well-being. We're interested in urban areas affected by violence and conflict. So this is talking about war-torn urban areas where conflict is happening in the city, such as Baghdad, Mogadishu, Kabul. And also urban areas where conflict and violence is generally linked to state failures to provide security, like the whole discussion around fragile cities. So you see Johannesburg, Nairobi, Mexico City, although I think drawn sort of less on that probably so far, but that's the idea. And urban areas affected by population displacement. So we're interested in cities where populations are coming in. So there may not be a conflict in the city, there usually isn't. People are avoiding conflict and coming into those urban areas. And often what we see, as you know, is that people are bypassing camps to settle in urban areas. So whether they're spontaneous settlements or within other ways in urban areas, and often can stay many, many years in protracted situations. And then we're also looking at these complex emergencies. So you can have conflict, large-scale, massive displacement, food shortage, hazards. So there's some examples of cities that have been affected by all of these things at the same time. So this overlaying of acute and chronic crisis is a very nice case study on Goma in DRC that outlines some of those situations of complex emergency over a number of years. So we're started doing this table, which is a work in progress, which is trying to go by the different sort of, let's say, crisis situations in cities, and then the literature that supports those that we've found. So this is a work in progress. I can even think of ones that aren't on here yet, but we've got sort of building that up. And there might be ones you'd want to add on there. I mean, I think what this points to, which is quite interesting, is the numbers, like the sheer scale of urban crises, is that it's actually, if you start to look at it globally and the types of responses, that responses have happened in all of these urban areas, you start to add it up, it's quite interesting to see the scale of this issue. A couple of words on the quality of evidence. So we've been asked to try to evaluate the quality of evidence, and this is kind of an interesting thing to do, because what you see across the different literatures that we've looked at is a mix between what I call experiential and empirical. So I know experiential is empirical, but I was saying empirical is in like a proper, a type of research study that's been done. So there would be interviews conducted, there would be an analysis of those kind of things, or there would be some sort of data that's been looked at, versus experiential evidence, of which there's massive quantities, and there's a lot of learning that comes from these, which is about someone's experience and them writing about those experiences. So in the humanitarian studies, we find that mostly the evidence is experiential. There are a few studies that are more empirical, that have gone, for example, to interview and to document within an organization a number of responses in urban areas, and they're learning from that, so that's more empirical, but largely experiential, of people writing about their experiences. The other ones you see sort of a mix between empirical and experiential, and I think in public health you have much more empirical evidence. Just a couple of mentions about this humanitarian studies literature and some of the issues. So most evidence, as I said, is produced by humanitarian actors on their experiences in the field. They're not usually drawing on design studies, and there's a lack of longitudinal data from these experiences. I guess the question is on really I know there's a lot of important learning, and I would never discount this because I think it's very important, and I think people don't write down enough what they're learning. There needs to be a lot more of that. But also, the type of research or work that needs to be done is probably to understand outside of this circle of humanitarian actors what is happening and what are the impacts of humanitarian work on the larger urban systems and how they function. So there's really a lack of evidence where existing governments, actors, and institutions have responded with little or no external assistance also. So there's a lot on the humanitarian elements, but what is happening outside of that? There's probably quite a lot, but not a lot of research done on that. And I think all of those things can inform humanitarian practice. Probably a need to draw on wider concepts for theoretical or practical insight, learning, and evidence. And I think, like, for example, we're trying to do this from the urban development perspective, so having these kind of people who work in different fields maybe coming in and saying, showing some things could be helpful in terms of developing sort of innovation. As Victoria mentioned, there's a need for understanding of the pre-crisis context and the whole urban context upon which the learning is based. And I'd say overall is that most research has tended to focus on inputs and outputs rather than the longer term outcomes. So really, like, we're having trouble answering these questions about the impacts of the humanitarian response over on the functioning of cities overall, because there really isn't that much, and perhaps these can be important for learning. Impacts of crises on urban areas and the challenges of urban response. These were the 4 questions we were given in the terms of reference. But there's a need to adopt, as Lucy mentioned, this urban systems perspective. And so we've tried to think about how to do that. Organizations must recognize that while they might be used to working in sector-based clusters, urban environments require a coordinated multi-sector approach, which was quite well, came out in the workshops also. And I can't provide an answer to this at this moment, but I just wanted to throw up a few things. This is from Jo De Silva's and her group's work, looking at climate change and different urban systems. And so these are some of the ways that we can characterize urban systems. I mean, this has a very ecosystems and climate change perspective, and if you were to think about the systems from what is to be affected in a disaster or a conflict, you might come up with different sort of systems. But I think that would be a good thing for us to do, actually, is think about these kind of systems. This is from the city of Barcelona. They're doing a lot of work on urban resilience, and these are the kinds of critical services supply. These are the sort of systems that they look at in terms of an urban system. And these are how they've organized their clusters to try to work across city departments. This is also from Jo De Silva's work, and I think the interesting thing here, particularly, is that you see that we have urban infrastructure and we have urban institutions, and then the knowledge that underscores them. And so really, if you think about urban systems, you're not just talking about physical systems, but also knowledge systems, government systems, etc. And this one being for water, for example, is quite interesting, because this is like how people are accessing water, trucked water supply, independent boreholes, municipal water, rainwater harvesting, normal water infrastructure. So these are kind of, in a typical city, this is sort of the system of water. And you may have actually multiple different institutions. You obviously have private sector water supply if you have trucked water, etc. So this is kind of an interesting way to think about those things. This is from Laura Hickup's master's thesis, and I think the interesting thing she's talking about here is the difference between the response clusters in humanitarian response and also the sectors in municipalities, and that there is this sort of level of governance that brings all of these things together. And I think that's a little bit what you were talking about, Victoria, having this sort of coordinated kind of response for that. So I think there are various people who are thinking about related things that we will bring together. Don's going to talk about the governance.
So I'm going to take you through some of the more specific findings from the 4 themes that we've been looking at, beginning with urban governance structures. And further to the terms of reference, I'm going to be addressing these particular questions, which I'll briefly read. How do crises impact on urban governance structures and capacities? What are the humanitarian response interventions that have responded to urban governance structure and capacities? And then how these interventions have then impacted, whether positively or negatively, on this governance. And then briefly we'll be looking at the challenges of responding to these structures and capacities. So firstly, looking at the impacts on local governance, the inadequacies in terms of unaccountability, corruptibility, ineffectiveness, incapacity, limited authority are widely identified as a key driver of risk and insecurity, and as a key challenge for effective humanitarian response. The humanitarian literature that we looked at also noted how these capacities can be further eroded when municipal staff are affected by disasters or conflict or implicated in urban violence, but also how vital administrative resources, whether they be land registers, maps, office equipments, or buildings themselves, have been damaged or destroyed. But also how the rapid influx of internally displaced persons or IDPs and refugees can create additional burdens for urban administrations and governance structures, which may not always be willing or able to support the provision of humanitarian assistance. There's also some mention of how humanitarian impacts can impact then on local governance. So this can happen when humanitarian agencies provide services rather than strengthening local governance capacities, which can work to further erode already weak capacities. Also when they tend to perhaps overwhelm local government and civil society organizations, or don't necessarily form effective partnerships, or when they tend to position themselves at the center of response efforts, and when humanitarian interventions are separated from their political environment. And we looked at this literature on humanitarian space, which is typically looking at, or is conceptualized as the arena where humanitarian agencies provide services to affected populations in accordance with humanitarian principles about neutrality and independence. But we also came across a few studies that were quite critical of this conceptualization, and was really asking the question of really whether humanitarian space is much more political than it is currently conceived. And as Cassidy mentioned, there's one interesting case on Goma that addresses this question by Boucher and Vlassenroot. And this is actually quite a mixed method study that was published in Disasters, so it's quite it's more rigorous than a lot of the stuff on governance we looked at. But so it looked at how the presence of international humanitarian agencies and also their interventions, and I'll just quote, have reinforced a process of state withdrawal from public services and have instigated a transfer of power and legitimacy to the advantage of international actors. The study also noted that the dominance of such actors has significantly reduced the bargaining power of new state administrations and limited their capacity to attach conditions to humanitarian interventions, which often force administrations into a position of negotiation. And perhaps this case raises the question of, or illuminates the contradictions perhaps that can arise when agencies justify external intervention based on the inadequacies of local governance, even though they themselves may not necessarily have any local legitimacy. So this is particularly critical look at the political impacts that agencies should have, and I thought it was interesting to summarize it here. Now, looking at specific governance responses, governance in general remains an emerging theme in much of the humanitarian literature, but it remains a gap. And potential reasons for this, as Cassidy mentioned, are the focus on really the challenges of response in urban areas where governments are weak and unaccountable. Haiti is a commonly cited example. And then a focus on urban areas where major response and relief efforts have been coordinated and implemented mainly by humanitarian agencies. And then other cases where that intervention hasn't, where governments perhaps been able to respond themselves are not particularly well documented. I can think of two case studies on Colombia on internal displacement, which is interesting. In terms of good practices in governance, of course, engaging with the private sector is often advocated, but as Crawford cautions, but with little analysis of the capacities, needs, and imperatives of the sector. Cash-based transfers, as Victoria mentioned, also are emerging as a good example of humanitarian private sector partnership. Although there are studies that mention that the main interest is commercial rather than just necessarily humanitarian. But in general, most thinking about engagement tends to fall under the umbrella of corporate social responsibility. But studies also draw attention to the fact that the role of business in humanitarian response extends well beyond just large companies. And Cassie will be talking a little bit about some of these sectoral studies that have looked at potentially engaging local service providers in water and sanitation. There's also one or two studies on engaging local providers in terms of healthcare. There are also some interesting cases on actually growing examples of where community-driven responses have kind of led efforts themselves. And these come mainly from affiliates with Slum Shack Dwellers International and the Asian Coalition for Housing Rights. And there's interesting case studies on Philippines and as well as Thailand in that regard. But in general, there's a need to better understand the conditions that really could potentially enable those processes to scale up. So there's another number of operational challenges that are identifiable from the literature. The first being engaging with existing actors and institutions at the local government level, which all notes may require agencies to reorient themselves into more of a support role, which might require many skills that a lot of agencies may not necessarily have. So engaging with informal governance actors. So there's a number of various studies that deal with specific actors, and I'll walk you through a couple of them in brief. So in Peshawar is a good examples of kinship networks and traditional structures for support and community leaders and committees that often negotiate with municipal authorities for basic services. Metcalf et al. Look at the role of warlords in offering protection to displaced populations in Yi. There's examples from Kabul where community organizations have led service provision but also been involved in security, education, and land administration. There's also an emergent body of literature looking at humanitarian challenges dealing with gangs and urban violence. Although there is a recognition also that engaging with these informal actors, whilst may be important in the short term, may not necessarily be an effective solution in terms of building more effective urban governance. And the final challenge really looks at engaging with crisis-affected communities who often take it upon themselves to respond, recover, and rebuild, particularly where local governments may not necessarily be willing to provide assistance, or where these communities may not necessarily wish to be assisted. Specific challenges, again, including urban authorities who may be unable or unwilling to support assistance, and perhaps many agencies might not necessarily be set up to engage in people-centered processes, which is a common critique within the literature on building back better. And of course, there's ongoing challenges of targeting invisible populations, such as IDPs and refugees who may not necessarily wish to be identified.
So we've also started to look at the urban infrastructure and service systems. And these are some of the systems that we think we have literature on. And we're trying to kind of work on this on the way, looking at the different systems perspective that I was presenting earlier. But I'll talk now just about water and sanitation. So estimates suggest that up to 50% of urban dwellers in Asia and up to 70% of those in Africa live in ill-served informal settlements, so settlements that don't have access to piped water, to sewage networks. So when you're thinking about crisis situations, as many of them are affecting these areas in particular in cities, and they're often the most vulnerable areas to natural hazards, and also the people are most vulnerable in those areas. But if we think about it, as I was mentioning earlier, if we think about the forms of water provision, for example, and the access to water certainly varies across areas. You have parts of the city with piped infrastructure and parts with non-piped infrastructure. You have many people accessing water through individual wells or larger boreholes. Many people are getting water through water vendors and water kiosks and trucked water. So before there's any crisis in the city, you have major problems actually with the quality and quantity of water and people's affordability to access water. So these are actually like chronic sort of crises that are existing in the city before any sort of humanitarian intervention or any crisis actually comes up. And then in a crisis situation, we started to think about what are some of the impacts. And there's a few studies. War and conflict, for example, was found to have an eroding effect on institutions such as water utilities. There's quite an interesting study that looks at the water availability in Kabul, for example, over a number of years and relates it to certain events that happened in the city. And so often, once electricity is not working, then pumping facilities for water can interrupt the ability of piped water, for example. Earthquakes are causing partial or total disruption of the infrastructure system, and the movement of people requires actually whole new systems. flooding and high water table, unsafe water in flooding situations. And usually it's the urban poor who will suffer disproportionately in these kind of flooding situations, who are often living on the low-lying land. We haven't found a particular reference for this, but this was sort of brainstorming, thinking about that the increased demand for water due to increase in populations in IDP situations. You often have, I guess, situations of water stress. In thinking about what impact have humanitarian response interventions had on the functioning of urban water and sanitation systems, there's some interesting literature looking at that have actually studied the partnerships with local service providers, both in emergency and in rehabilitation of water systems. So looking at the partnerships with local water utilities, Pinera et al. Found that the most effective way to provide quick results in disaster situations in BAM was actually to work with the local water utility to help to repair some of the basic infrastructure. And this was the way they could provide water more quickly. And also a study in Gujarat looking at similar things. And strengthening the existing and communal institutional structures through partnerships. There's a study done by Ozodem that looked in Tuzla on how this was done during the crisis situation. So there's a sort of interesting literature here on how to do these partnerships, and quite some detailed studies on those. Pinera and Reed provide an overview on the kinds of activities that are required within the partnership in urban areas specifically, such as whether humanitarian organizations repair damage to the infrastructure, they act as intermediaries between the consumer and the water utility, or do institutional strengthening. And I think there hasn't been a lot looking at how to work with the other sort of non-infrastructural water networks, such as the water tankers, etc. And also they've done an interesting piece of work looking at Kabul and Monrovia on the rehabilitation of these systems and on the partnership. So there are some actually quite detailed studies on that. There's also some work on innovative technical and operational solutions. There was a literature review done a couple of years ago for a waterline special issue that looked overall at the literature, not on urban particularly. And I understand Richard's actually working on something on urban, so maybe you can fill in more on this. But basically what they found was that there really was a need for innovative sanitation options in urban settings, and I think that's why all this work has started to be done on this. And some examples of some of the issues, from Haiti, which is that dealing with the waste from toilets and how to dispose these, especially in urban contexts. I think in Haiti this was a really big issue about where to dump this waste. And so there are different sort of technical options on biodegradable bags that can be quite good for the first few weeks, raised pit latrines. There's quite a lot of learning, and especially very interesting reports, like for example this one by Oxfam that has incredible amounts of learning and detail that is actually written down and documented in a sort of bulletin format. And also their experience of using cash for work and daily laborers and camp contractors in the water and sanitation. So there's sort of a lot of learning there that is starting to be written down. In thinking about the evidence and research gaps, particularly in water and sanitation, I think from Victoria's report is this technical assessment of existing infrastructure networks, as she mentioned, understanding sort of the whole context of water and sanitation in the cities before. And also the need for innovative sanitation options. And I think on this, more work on these partnerships and how they work with different kinds of government structures, whether it's centralized, decentralized, and how they can better function in those ways. And I think this question is really on the impact that these interventions have on the functions of urban water and sanitation systems. There is some studies that are starting to be done such as this one in Kabul and Monrovia, that start to answer those questions. Yet I think there's a lack of empirical work in that area. Urban markets. I think, as Victoria mentioned, I think there's really, this is a kind of a new area of research, and we can find, if you look through all of the literature and you try to pick out, there are various mentions here and there of how humanitarian responses try to work within market systems. There's actually quite a literature on food. We'll talk about that in a minute. But I think there's generally an understanding that there are monetized markets for all goods and services in urban areas, that there's a cash economy and various layers of informal and formal financial institutions. And there's lots of understanding of how markets are sort of impacting. For example, understanding in Gaza that there are the extra burden of rental payments and loss of assets following the destruction of homes by the Israeli military has put pressure on household budgets and made it more difficult for affected families to meet expenses such as education. So there's an understanding of sort of how this kind of cash economy and cash market in cities is impacting on people. Sort of a few studies on that. In trying to understand the impact of these, we've looked at, for example, adapting the approaches to encompass markets. So there's a lot of, and as was mentioned in the workshops, going towards this. And I think the other interesting thing is that there's sort of require adopting market-based approaches in non-traditional market sectors, so like water and housing and education and health, when these are normally humanitarian organizations are providing these. There's a whole new approach to adopt, a market-based approach to that. And we've done a little bit more specific work on the food markets, because there is a kind of more literature on that. So I'll let John present that.
So this seems to be a kind of an emerging area of interest within the literature. Although food insecurity was traditionally viewed as a rural problem, there's some interesting case studies that are coming up, some of which based on experiential evidence from places such as Liberia, Gaza Strip, and Djibouti, which is from FAO, and then some also interesting work on looking at the kinds of assessments that are required in places such as Haiti. So based on the literature, there's a number of impacts on urban food security, which include when the linkages between rural production systems and urban food markets are disrupted, and also when, as a consequence, food stocks are then diminished, and the resultant price hikes, which obviously has disproportionate impacts on those with low incomes. So this draws attention to, in the urban crisis context, it's often accessibility that is the issue, rather than just availability of food. So looking at some of the responses to urban food markets, experience from rural areas has shown that this has typically involved physical food aid delivered through relief committees in the form of mass dispersals. But there's a growing recognition that in urban settings, this requires more of a dramatic shift that reflects the central role of markets in supplying food, with cash-based transfers and various cash programs being identified as a common practice. There's also recognition that traditional tools and methods for urban food security assessment, targeting, and distribution must be adjusted to meet urban contexts, including the integration of urban market analysis. However, interesting study by Campbell looked at or mentioned that despite the variety of assessments that have integrated market analysis, they are not necessarily consistently used by agencies on the ground. So moving on to our last theme, we looked at diverse communities. And these are the questions we looked at. So the first is, how do crises impact on people in cities? We added the question of how are different people impacted in different ways. And this really gets at the issue of diversity, with a view to the multiple and intersecting identities of, for instance, income, age, ethnicity, and gender that come together to shape people's needs and vulnerabilities, and by extension the implications for and what that means for response in urban settings. So we're going to be looking at these particular impacts on different people, and what the response interventions have been, and their impacts, whether positive or negative, and then concluding with the challenges. So in looking at diverse communities, we looked at two sub-themes. Firstly, health. So obviously, crises impact significantly on morbidity and mortality, which impacted people in different ways. And this reflects a growing body of literature on public health that draws attention to differential health impacts and the implications for both risk reduction and also response. We also looked at livelihoods because, again, urban economies are cash-based, so people must meet their basic needs in markets. So there are a number of studies that have looked at the particular health impacts along certain identities and variables, whether they be gender, age, income, ethnicity, and I'm sure a lot of you are probably familiar with these studies, or at least their findings. But I think the important thing to say is, and we'll touch on again, is that a lot of these studies have adopted a single identity-based focus, which hasn't really looked at how different identities and multiple identities intersect and then influence needs and vulnerabilities in different ways. And this being particularly important looking at the diversity of people that live in cities. And it's also just briefly worth noting that a lot of the data that these studies are drawn from national sample surveys or just national data, which makes it difficult to look at how different people are impacted in different ways at the more fine-grained inter-urban scale. So looking at responses, there's a recent review by Blanchett and others that found that healthcare interventions in humanitarian settings, well, there's little evidence on these interventions or on their effectiveness in terms of healthcare. Of the studies that were found as relevant, which were 27, all were observational, 17 were purely descriptive in design, and most were assessed to be low to moderate quality. Very few studies, if any, documented the impacts of health interventions on communities or healthcare systems. So there's one of the few systematic studies that have looked at these kind of impacts. By Lucci, who looked at the experience of MSF in 12 different countries and noted that overall experience in urban settings remains relatively limited, whilst defining most appropriate health interventions remains much a learning process. So a question that we raise is, what have been the impacts of health interventions by humanitarian actors on health in urban communities, and if any of you have any interest in these studies. In terms of livelihoods, we identified 3 different bodies of literature that looked at impacts. So the first involves a number of formative papers that have adapted livelihood asset frameworks to look at how disasters and climate impacts are impacting on the livelihoods of the urban poor and how the urban poor are using assets to cope and adapt. While these various frameworks do differ, they generally agree that whether or not a household can prevent or absorb disaster losses is determined by its ability to access assets in their various forms. And there's ample evidence to suggest that the urban poor are disproportionately impacted, mainly because their livelihoods can be quite vulnerable and informal. Their assets can be quite fragile, and because their health is poor, and often they live in hazard-prone locations to remain close to their livelihood activities. The second body of literature comes from Building Back Better, which focuses on the impact of urban displacement on livelihoods and on the impacts of humanitarian interventions around resettlement and relocation, with a particular focus on whether people's livelihood needs are being considered in that process. And this body of literature emphasizes how livelihoods ought not to be seen as separate from housing. It should be seen as much more holistically in kind of integrated manner. The third body of literature looks at migration as a strategy to avoid disruptions and threats to livelihoods among urban IDPs and refugees fleeing disasters and conflict. So studies show that displaced are increasingly settling in urban areas as opposed to camps because they offer greater access to livelihood and survival resources, and because they represent a site of independence that's perhaps not necessarily found in camps. Studies also note significant challenges that urban displaced face in accessing livelihood activities, particularly around where governments are not necessarily supportive of them doing so. But there's also other studies that draw attention to how there's little difference in the livelihood options available to the lower income strata of the urban poor, whether that includes urban IDPs, refugees, or low income, longer term residents, highlighting the fact that it may not necessarily be useful in some cases to make that, or just distinguish between these groups. But there's also been more of a broader failure to disaggregate research subjects in the humanitarian literature. So we don't really know a lot about these particular differences outside a handful of studies. And I think a lot of the work that ODI has been doing through their humanitarian policy group has kind of shed interesting light in that area. So looking at some of the responses, include cash for work programs, which have become common practice and have been particularly well documented in Haiti. There are also a number of studies that draw attention to the potential unintended impacts that these programs can have. And these include artificially inflating wages and triggering unsustainable shifts in labor force, undermining government legitimacy, and this is in terms of the expectation that needs and services should be provided by international NGOs rather than governments, and this was a concern voiced in Haiti in particular. There's also general concern that cash for work programs could impact on participation in future community projects, and the concern that they could create security risks in terms of risks of attack and extortion. More broadly, there's a concern that INGOs are creating, quote, a humanitarian economy or an emergency economy that is locking countries such as Haiti into a dependency on aid, and that's according to the Haiti Grassroots Watch. So looking at some of the operational challenges of responding to diverse communities, obviously there's a lack of disaggregated data, which means that humanitarians alongside urban researchers and policymakers know very little about the social composition of urban communities. And this has been noted on the literature on healthcare in particular. We also know that informal settlements are rarely enumerated, so we know very little about their social composition. Likewise, urban IDPs and refugees are rarely enumerated and constitute a hidden population. So these data gaps and the invisibility they subsequently reinforce obviously present obstacles for needs assessment and targeting, which is the second operational challenge that we've identified. So there tends to be an assumption within some of the literature that were appropriate data available, then appropriate targeting and response would occur. But some argue that this assumption reflects a paradigm that views society as comprised of individuals with identities and needs that can be categorized, quantified, and targeted to inform decision making. These studies point to a number of unintended impacts that can occur, such as when single identity labels, such as refugees, homogenize identities and needs of diverse groups of people, but then exclude those who might be in unequally precarious situations. Other studies point to how they can lead to the exclusion of those experiencing similar deprivations. If, for example, the urban displaced are targeted for assistance, and if the long-term needs of residents are not addressed. And what this is really getting at is whether we're targeting identities or the root sources of vulnerability. And this table attempts to show how this can be done by looking at maldistribution, misrecognition, participation, and susceptibility, and then looking at how these link with social identities in the urban social context. And this is very much a work in progress, so your comments and feedback are greatly appreciated.
Just to give some inputs on the gaps in knowledge and areas for further research. There's much innovation happening on the ground in response to conditions in urban humanitarian responses. So there's, people working on the ground are faced with a challenge, and if you figure out a way to deal with this challenge and to respond to it. And then there's a lot of learning that's coming out of that in terms of experiential learning. And so what we're wondering is, this incorporating applied research into emergency response and publishing the results is probably one of the big ways to think about how to accelerate innovation in response efforts. And also to think about how to do this research in this context and the implication for different methods of research. I mean, obviously, if you're responding in an emergency situation, doing research is not really a priority, or writing about it or anything. And so what are the kinds of methods that actually lead to good evidence and also very useful work that can help to improve response? And so I think there's really this discussion around fitness for purpose of evidence. What kind of evidence is going to be the best for learning? And also, I've made this point already, which is research is needed on the impacts of humanitarian interventions, both in the short, medium, and long term, and understanding from the outside of the humanitarian system, and more on institutional systems. But thank you very much for listening. I'm sorry it was a little bit over time. What we'd like to do is to go into breakout groups. I don't know if anyone wants to have any initial reactions or raising things here at this point in time. I welcome you can do that, or we can move into the breakout groups. Yeah.
Thank you. It's a huge topic, and it's amazing the scope of it. Could you? I don't know if you have shared it, if you have. I haven't seen the methodology, which you just for the techie people amongst us. What you actually did. It would be useful just to be able to look at that.
Yeah, we could. I think in the report we need to write it down and be systematic about what we did. But essentially, what we did is we've done it sort of from, I would say, expert-led intuition, which is we've used people who've been working on those particular areas, and then looked at the research that comes out of that. So it's not that we've done we have done database searches and looked in these search terms and stuff like that, but actually what that comes up with is fairly minimal compared to if you do a kind of more intuitive search.
Model for kind of the research that you're looking at, how to get the next very, very useful bits of research is expert-led intuition.
Yeah.
Thank you. Good model.
So that's what I would call it, yeah. Now, we thought of doing the groups along the four themes. So one on governance, one on markets, one on infrastructure, and one on diversity.
Okay, everyone, should we start again? We were hoping to just quickly go through the report back from the groups and then have time for a sort of wider, less structured discussion. And some final points from Victoria and Lucy. So can we just ask each group to talk the sort of maybe the two key things that they thought were gaps in terms of the review, or just wider knowledge gaps in terms of urban humanitarian assistance, and maybe two key things around how humanitarian assistance organisations innovate or not. So perhaps if we could start with the group, the big group who are looking at infrastructure and markets.
I think baselines was one gap. And we discussed the fact that when you respond in an urban context, you have to have an understanding of the city first and its baselines in order to then, before you intervene. But then the challenges around that were, as humanitarians, we have to respond so quickly. How can we do that? How can we do that in light of our time constraints? And there was some debate about whether that was possible. And I think probably not. But yeah, the need for sort of multi-sectorial baselines, and British Red Cross spoke about the fact that they have achieved it. So it is possible, but there's also constraints.
Any other sort of significant gaps that were raised in that group?
I think it's an interesting point about what we talk about a lot, the difference between urban and rural. And actually, in a lot of it's the same, but there are some definable differences in humanitarian phase? And I don't think that's, I don't know, maybe in the full report you might address that a bit more clearly? Or is it just that the project was done in an urban setting? And maybe that's something that's a bit of a gap, potentially, in terms of just defining clearly at the beginning of the outset, what do we mean by the differences?
So this is more a gap in the report about the sort of qualitative differences.
Yeah, what do we, like,
specifically urban code.
Yeah.
And in terms of the sort of second bit about the particular experiences or barriers for humanitarian assistance organisations working around innovation in relation to markets or in relation to infrastructure, is that something that you got to discuss on this?
I mean, I would say, sort of picking up on that, the point about the baseline, we had a discussion about whether there is, like, can you do research that leads to innovation if you don't have a baseline? And so we talked a little bit about maybe that's not necessary and that there could be other ways of doing things. But we didn't quite get into what was necessary for innovation in terms of what type of evidence.
Yeah, I mean, it's not necessarily just a baseline, baseline. It's like more about carrying out the right type of assessment to inform innovation or implementation, so we can actually plan appropriately. So it doesn't have to be a baseline, it's just, needs assessment to enable us to measure impact at various different stages of the program. And it's also, looking at the how to do that in an emergency context or recovery.
I think there is lots of innovative work that is being done by organisations, especially in relation to market-based responses. But a lot of it's not written up in a way that can be processed. It's not research, and it's not always, it might be a slightly quick and dirty mechanism, but it still leads to some very different and innovative changes in practice. And I think where the humanitarian community struggle is then there's not the funding to do better analysis of that and to capture that in a way which is accessible to a larger audience.
So there is innovation, but it's not documented and it's not analysed. There's not.
And then people are really aware that it's an imperfect process, and it's not as detailed as a piece of research would be. So they know there are gaps in there, and I think that's where agencies become shy about sharing that literature, because they can see what was really good about it, but they can also see what was imperfect about it.
We could go, if we go to the group who are looking at governance. So again, just looking at not the whole presentation, just a couple of the key gaps either in the report or more generally, and the innovation issues.
Well, I think we actually spent most time on questions 1 and 2. We don't carry on. But we did note a kind of a plethora of lessons documents and learning documents. Again, that are not necessarily written up in a way that can be processed in a useful way. And in terms of some of the conditions required to innovate, we touched on funding issues, but also on providing spaces for more rigorous research to be conducted. And then also a lot of agencies are not necessarily mandated to kind of evaluate these lessons documents or to engage in research, but more so to meet targets and evaluate the extent to which they were met. And a lot of things take a short-term perspective when, especially issues of governance, play out over a longer period of time, and that's.
Okay, so perhaps we'll move on to the last group, which was looking at diverse communities, and again, not looking at the whole presentation, just looking at. I think you weren't here, Sneha.
Yeah.
Just because we're trying to scale this back to the time for the discussion, just to say, looking at maybe the 2 key points about gaps, what knowledge is missing, and maybe a couple of key points about areas of innovation or barriers to innovation.
One of the things that the group felt was from the perspective of diversity. One was there were a few more social characteristics other than gender, age, which could be included, such as land tenure or security, especially if you're talking about informal settlements, and also literacy. For example, one of the discussions that we had was on communications as a form of a capacity of the communities that we should be talking about, and then how do urban groups which are more access to information systems can deal with information data. Another issues we had was then how do agencies target these groups? The formal operational system is to target such social groups rather than identifying what are the root causes which at the household level which first led to the vulnerability from a disaster. Another important discussion that we had for a long time was looking at humanitarian assistance and redefining it in terms of the principles. Are we just looking at life-saving operations, trying to be partial and neutral about the operations, or do we also think about longer-term effect or longer-term outcomes? And then how do we build that into a program of proposals or implementation and assessment, and also learning from not just within the organization but also from across different agencies who are grappling with similar issues. So these are some other discussions that we had.
From what's coming out, what I've been hearing is, one thing I noticed that Cassidy flicked through on the slide, but I think you said that we obviously tend to do research on areas where international humanitarians are responding to emergencies. What about all the areas where people are just getting on with it and their cities are set up to cope with recurring emergencies, and we don't have the documentation for practice there? So it's one area that sounded interesting. Or as Victoria put it, the bits of cities that don't receive humanitarian assistance but just pull themselves together anyway. And then some of these sort of longitudinal studies, 5 years on or 10 years, the potential to go back to a city and look at what the impact of that disaster was and what the impact of any assistance received was in terms of city systems. So those are some ideas. Oh yes, the holistic looking at urban systems. Yes, and that issue that we tend to look into a lot of the sector literature, because there isn't this kind of urban systems literature out there. And is that something we need to start promoting? Is that something we need to start funding? Understanding how city systems are impacted. So those are just some random reflection thoughts. But I think if you just want to open up the floor to further debates and recommendations for the types of studies that you feel would be useful, that you ought to take into consideration, and how we're going to collect that data.
I'm trying to find a way to turn the humanitarian spotlight a bit more on the chronic conditions in slums and peri-urban areas. I think it might be really interesting to look at it from a perspective of a slum and urban area and what happens when an event, a disaster event occurs, or there's more increasing funds attention, and what happens in the slum. That's the thing that we should be paying attention and asking ourselves what baseline information has the local government got. It should be about their information rather than our information and our systems. I think that looking at, and this is entirely consistent with a lot of the literature I've read that says, we need to think about local actors, local government. So let's do it from their perspective rather than our perspective, and let's focus on those areas.
Just to add to that, I completely agree, but I would question who the we is on that one, which is, if we're looking at the chronic and what happens when a crisis hits chronic poverty, chronic disaster, it's the humanitarian to look at it. Shouldn't only be. Basically, that's a development problem. And we as the humanitarian community here, I think a lot of our job is to get, whether it's development economists, development, everybody should be thinking about what happens when a crisis hits my development, and actually their problem, at least as much. Markets, infrastructure, all of those headings. So the we, I completely agree, but the we, let's not think we humanitarians, let's think we, anybody who's trying to contribute to assist, and we should be lobbying to get the development people.
I think in the review we've been trying to go between, because here we work on this work on urban development and slums and the responses of local governments, and that's the stuff that we do normally. So we've been trying to work towards, let's understand a bit about that, and then let's look at what humanitarians add to that, or what they can learn possibly from those types of interventions.
On the kinds of study, I think one of the reasons why so much of what we learn, and a lot of what we're going to learn, given that most of the people who are working don't have time to learn the humanitarian crisis, or people who are doing stuff, and they don't have time to set up the HDCC completely correctly. So a lot of what we're going to learn is inevitably going to be queer literature, experiential literature, and so on and so forth, and that's great. Or at least it would be an awful lot greater. Like, one of the reasons why so much of that is secular, is linked to that, is because we go off and we look at needs. We count what people don't have so that we can fill the gap too often, rather than going out to try and understand what's going on to see how we fit in. I think that's the kind of mindset that we need to change. And it'd be really nice if no humanitarian donor ever funded a humanitarian project which only gave, here's what people don't have, if there wasn't also a discussion and an analysis of what people are currently trying to do. Because it's very, very rare to find that in humanitarian reporting, either in the problem analysis or the needs assessment rather, or in the evaluation one. It tends to be around what they don't have and what I'm doing. And that would inevitably, over time, this isn't going to be some breakthrough, but I think inevitably over time, we start to break down this sectoral focus, because what people are doing is inevitably not sectoral, because partly because all of their needs can merge together, but also because if we were trying to understand what's going on, we'd be looking at who are they going to, who are they speaking to, what's local government doing, what's informal, and all of that. And that kind of needs a change in mindset of how agencies think about what they're doing with the problem. And I think if we were back here in 5 years, 6 years' time, reading through a lot of these reports that are made available, I think we have a hugely rich, no perfect methodologies, but huge amount of experiential learning.
I'm Raphael, I'm from INC Worldwide. I found a big gap in literature recently. I was leading a project for the World Bank on transport infrastructure resilience, and found very little respect to that in developing countries. Most of the research I drew on was from the US or the EU or the UK. But most of the case studies were developed world. Maybe that's partly also because humanitarian actors don't really engage with transport projects, large complex infrastructure projects. So I know the World Bank just commissioned the study, but it wasn't massive. There could be a lot more research done on this. And UN Ops have also commissioned Arab to do a study on infrastructure assessments. So there's a few little things going on, but it's not massive yet.
Sophie, I'm a researcher. One source of evidence on the effect of intervention on health are the Cochrane systematic reviews. And I know at least 3 of them, they are looking at urban slums and humanitarian, aid or humanitarian intervention will be scoped in those reviews. And one that I'm currently working on, which is on the nutritional outcomes of intervention on focusing in urban slums. And from the scoping review I did, I already found some studies coming from the humanitarian aid sector that were not in the peer-reviewed journal, but where you can find, you can find there is some evidence, limited, but there's still some. And from your findings, I've seen that health has not maybe been fully explored yet, and Cochrane is a good source. Okay, Cochrane review, yeah.
From CARE. It's interesting to hear everyone talking about this, some things that come in my head, but we seem to have a different expectation around our humanitarian urban work than maybe our humanitarian rural work, in terms of, if we think about it as purely humanitarian intervention and at the time it may meet our objectives and do what we think we're going to do, we seem to have an expectation that the urban work will have a somehow positive effect going forwards on the overall development, re-establishment of systems in when I know that maybe we have that aspiration at a rural level, but are we somehow defining that as different in the urban setting? And actually do longitudinal studies of urban or even rural work, particularly FAIR, on humanitarian stuff, which is very much focused on the needs in a very distinct period of time, with it help with an effort to try and lead towards early recovery or whatever it is, but actually that often come out very badly in longitudinal studies over 5 to 10 years because communities' expectations and capacities change over that time. So I'm just, again, with this difference between urban and rural, wondering whether we have a different expectation of our own, the ability of our own work to do something beyond meeting the immediate needs and sort of early recovery needs. And is that, if that is realistic, then that's great, fine, but do we need to define that somehow as part of this as well?
Yeah, and Richard Laugh, independent. I mean, I raised that in the infrastructure session. I think there are unreasonable expectations being built up for urban recovery work. So we're everyone's being set up to fail here.
Urban response, right?
Yeah. The reason why it's more difficult is because it's a more complex environment, and therefore the likelihood of failure is greater. But I think the issues are similar in the rural areas, it's just that it's much more complex in urban areas. And the constraints are greater.
So something I was raising with the group that I just found interesting that I thought for me might be an interesting point of reflection is there seems to be quite a strong emphasis on market-based responses to ensure the sustainability of humanitarian assistance as a sort of way of ensuring long-term impact. But from the point of view of diverse communities, I was wondering if people had a feeling that there might be trade-offs between relying on market interventions and, given the way markets work, increased inequalities, particularly for vulnerable groups. And I don't know if that, we talked about it a bit in the group, I don't know if that's an experience that people have more widely, so I just wanted to...
Yeah, I totally agree. Urban context is much more complicated, complex. But sometimes, I think especially for infrastructure and and shelter and rolling out programs, no matter how small or large they are, the urban context can bring about some strengths and successes because you are more close to markets and you are closer to have access to different suppliers and from my experience, actually, I've really found working in the urban context in an emergency really easier. Yes, okay, there are failures, but I think we need to also look at the strengths in working in an urban context.
Julian, just to add to that, I'm Amelia, also with the British Red Cross. We talked a little bit about communications, and it kind of is cross-cutting, but it can also, communicating with diverse communities is a challenge in urban context. It's also needs to be sort of part of your assessment now, is what are people's communication needs, what communication do they rely on, also levels of literacy, levels of access, but also part of their strengths, that they, not just seeing affected communities as just vulnerable victims, but they also can be quite capable of, two-way communication, of implementing and, cholera prevention programs or shelter assessments or governance initiatives. And so I think communications somewhat, I think Sam presented it as Kathmandu study. I think it'd be quite important to look at, but not just as a one-way street, okay, there's another need we need to fill, but actually it's a difference of working in urban areas is that there are different expectations in terms of communicating with affected communities and also different opportunities, as you say, different strengths, and it sort of brings it more to the 21st century.
Just on that, I think it'd be really interesting to see if there's any literature that exists around, or not, but just as a point, sort of incentives and how to incentivize governments. And I'm thinking particularly from the refugee displaced population angle and looking at what Oxford is doing around refugee economies, but building on the point that was made about positive, trying to turn it around and recognise opportunities that urban contexts provide. Taking that one step further, how do we then provide incentives to host governments to work with us in the humanitarian community and provide incentives also to other actors like the private sector? So that angle I think is very, certainly not documented very well in literature.
I guess one of the questions for me coming out of the discussion is, in terms of thinking about, maybe research on the impacts doesn't help to innovate, or maybe it does. I guess the idea would be that it would help to improve practice, to innovate, to think of a new way of doing things, but perhaps that's not the case, that having those kind of impact studies is, maybe it's too long distance, I don't know. putting that in. Okay, well, thank you everyone very much for joining us today. It's really a pleasure to have you all here, and really, I think there's a lot that we have here that we'll try to put into the report. If you want to review the literature review before it's final, please let me know, and we'll put you on the list.